Hi, everyone. Amy McMillan here, mobile vestibular therapist in Northeast Ohio. Today, we are going to go over the habituation portion of my book, The McMillan Method. It is a crucial part of dealing and treating with PPPD, or persistent postural perceptual dizziness. And because I think it is such an important part, I am dedicating an entire video to it. So, first of all, what is PPPD? Persistent postural perceptual dizziness, the most common cause of chronic dizziness. It is normally going to be starting after a true vestibular attack or a panic attack. And the key treatment strategies for this are that you use vestibular therapy. You may benefit from cognitive behavioral therapy, which is incorporated with some of these treatment principles, and possibly medication. It normally is not going to involve a vertiginous kind of symptom, but more of a all over kind of lightheaded, disoriented type feeling that's worse with visual stimuli or just excessive movement around you. It is quite debilitating. So we use a treatment strategy called habituation. I've used this for over a decade, and it is a technique that involves repeated exposure to a stimulus until your body becomes accustomed to it and stops reacting negatively. So it's kind of like if somebody kind of pokes you in the shoulder, and at first it's really, really annoying and it bothers you, but then after time, your brain stops recognizing it and it stops feeling like, I'm at a threat, or I can just get numb to it, get used to it, and it won't bother me much anymore. That's kind of what we do with habituation. So it's a very intentional practice. A person can promote an appropriate response with less anxiety and more confidence by overcoming a specific challenge. So when it comes to dizziness, this means picking a movement or a position or environment that initially causes dizziness, but you do it in a controlled, safe manner. You're expecting it almost until your body learns to tolerate those stimuli without triggering a dizzy response. So that's where we use some cognitive behavioral therapy techniques where we're trying to figure out, is this an appropriate response? Do I have control of my body? Can I calm my way out of this response? And over time, we can get desensitized to this thing that causes dizziness. It can be extremely effective to use this habituation technique, but it has to be done correctly. For it to work, it has to be completely individualized and self-guided. So everything that you're going to be doing with this goal setting workbook, if you have it in the McMillan Method, you'll know what I'm talking about. We're going to goal set, find problem areas that we want to work on, and figure out how to tackle those. Each person starts at a different level of readiness. So what that means is no two of my clients are exactly the same. Some clients, it's important to them that they go out with their spouse to a restaurant, and that makes them dizzy and uncomfortable. So that's what we target. And then another client may have to do travel for work through an airport, and that's what their specific target is. And everybody has a different amount that they can tolerate, and that is okay. The goal when you do habituation is to touch your symptoms, to just experience a little bit of uptick in your dizziness, but to make sure that you have an exit strategy, that you feel in control of your body, and that you can always let your symptoms come back down to baseline. Now, this is an important concept. I want you to make sure that when you're dealing with chronic dizziness, that you focus on function over symptoms. It's such an important mindset to learn with habituation. So remember that we're starting at a pretty low level for each person. And then as you improve month by month and make those goals, you might not be completely dizzy free, but your function is going to be better. And that is what you have to celebrate. That's what you have to take in the win column. And if you can celebrate those functional wins and stay focused on that concept, your symptoms become secondary. You almost become distracted and they're not front of mind all the time. You're focusing on what you can do now, what you couldn't do before, and how you're going to achieve your next goal. So what does that look like? So in the McMillan Method, I have these monthly goal sheets. So what you do is you take 3 big monthly goals that are important to you, and then we break them down into weekly goals, and then we track our progress over time every day. So we can actually see our progress. So just so we can expand and blow that up a little bit. So we have our monthly goals, our weekly goals. So what the heck does that mean? Let me show you an example of how you would take this habituation process and put it to work. So let's say we have for October a monthly goal of driving 2 miles without pulling over. So driving in a car for 2 miles without pulling over. That's our big goal. Our second goal for the month is to tolerate shopping in Target for 15 minutes. And then our third goal for the month, something that's important, is to stop feeling the 8 out of 10 pulling sensation when I lean to the right. Now, I did not make these up. These are all specific triggers and activities that I have worked with my clients to overcome. So we have our monthly goal, and now we try to start to be creative. How are we going to achieve that? Because it's not going to happen overnight. We have to set little goals. So each week, we set a goal. I will drive 3 back roads. I will watch a GoPro video of shopping at a Target in seated. And then, third weekly goal, I will sit and lean to the right for 20 minutes. All right, and then daily practice. Are we actually doing this? Are we keeping on track? So if we fill that out, it's maybe on Monday, I was a passenger in a car for the 3 roads I want to drive tomorrow. That gives you visualization. That gives you a partner or a friend who's doing the driving so you can get ready to experience the stimuli. You know the exact route. You know when to turn your head and check for stop signs. So it's a little easier to do that than all of a sudden go, I'm going to drive tomorrow because I have a goal. So let's wean our way into this stuff. Monday, for the target goal, I watched 2 minutes of a GoPro video on YouTube in seated. And then thirdly, on Monday, I leaned to the right 3 times while practicing holding on to a chair. Why did I hold on to a chair? Because it gives you more groundedness. It gives you more somatosensory support. So again, you're in control of that motion. You have a goal and you did that task. So then on Tuesday, maybe we take it up a notch. I drove 3 back roads with my friend as a passenger, and I was the driver. Then on Tuesday, I watched 5 minutes of a Target GoPro video and seated. That's going to get me used to Target. That's going to get me used to the stimuli and the vision, the visual stimuli that I will experience when I'm there. And then Tuesday, I leaned to the right 3 times without holding onto the chair. So just a way to make it a little bit more challenging. And then Wednesday, say I did really well, and then I decided I'm going to drive the 3 back roads by myself. And then I watched 2 minutes of the GoPro video, but I did it in standing because that is less support. And then an advancement might be to lean 5 times to the right instead of 3 while holding on to the chair. And keeping in mind, that puts us all back to our big monthly goals. And then the following week, you would just say, okay, I'm going to take this the next step, the next step, the next step until we can achieve those monthly goals. And maybe it takes you another month to achieve driving 2 miles. That's okay. It's very slow and you have to respect what your body can give you. So let's do one more example so you can kind of figure out how this habituation works really well. So say November, next month, we have a goal of walking 15 minutes in your neighborhood, walking across a grocery store parking lot by myself, and be able to close my eyes in the shower and wash my hair. Again, all goals that I have come up with clients, and these things all triggered their dizziness. So for our weekly goals to complement, I started with using walking poles to walk 5 minutes straight with a friend. And then for my second goal, I used a grocery cart to walk across the parking lot with a really heavy grip. And then third, my weekly goal is going to be to stand in the shower, holding onto the wall, and tip my head up to the faucet for 30 seconds. And that's going to get me to my big goal someday. So, what the week looks like, I started really less challenging, walk inside with my walking poles for 5 minutes straight because it's comfortable. I know my area. So I tried to use 5 minutes inside versus going outdoors. For walking across the grocery store parking lot on Monday, I walked outside in the middle of my driveway without any poles. Again, a spacious area. It's comfortable to me because it's my house, and that'll get me ready for maybe going to the grocery store. And then my third thing I did on Monday was stand in the corner of my kitchen with my eyes closed for 30 seconds in preparation for getting me to stand in the shower with my eyes closed. On Tuesday, maybe I walked outside with my walking poles and a friend. So that's a way to advance my Monday goal. And then on Tuesday, I walked outside again in the middle of the driveway. Maybe you had some dizziness and you don't feel like you can progress. So you just continued with the driveway walking. And then on Tuesday, for my third goal, I stood in the corner of the kitchen, closed my eyes for 30 seconds, and I moved my head up and down 3 times. And then on Wednesday, I decided to advance, walk 5 minutes outside with the poles and my friend because that was still challenging. So I kept that same task. Wednesday, go to a parking lot and stand 60 seconds, no support, and turn my head left and right 5 times. So you can see how individualized these things are, and it might seem tedious, but the more that you can prep yourself for real life situations and teach your body, I've done this before, I've experienced it, and I can handle it, you will be able to achieve your big monthly goals. So make it as realistic as you need to be. If you have a goal of walking on the beach with a friend, you have to do that particular task. You can't walk at the YMCA and expect that to carry over to walking on sand with wind blowing and talking and looking at your significant other. So all those variables make it harder for your body. So keep your tasks as real and as specific as possible. So important takeaways for habituation. Stay focused on function and goal setting, not your symptoms. So even if it's 30 seconds longer or a minute longer, that is still a win for you before dizziness starts or before you feel like you have to step away. I always have my clients try to start with a master list of limitations, not symptoms. So think of all the things that are difficult for you to do that you want to be able to work on. This is very important. And it's not to make you feel bad about your functional status. It's about to give you a starting point. And then you're going to pick 3 tasks each month, fill that goal sheet out. And when you tackle those goals, you're going to pick 3 more off your master list. Again, the progress is going to be slow, but progress will be made. If you do not have the McMillan Method, How to Self-Treat PPPD and Chronic Dizziness, which is on Amazon, you can just get your habituation goal setting copies in my Stand store, and I will link that in the description and the comments below. So hopefully you enjoyed this presentation about how to use habituation to decrease your chronic dizziness and treat PPPD. So until I see you next week, stay healthy, stay steady, stay strong.